Hello and welcome to our second webinar in our series called Support for Caregivers of Bereaved Children. Today we're going to be talking about, so this is our second webinar, it's week 2, and we're talking about Children's Grief 101. The last time that we were all together, we were talking about Grief 101, and so this week we're going to see what that looks like through the lens of children and youth. So who we are, so my name is Orly Culverhouse, and I am the Caring Hearts Children's Program Coordinator and Music Therapist at St. Joseph's Hospice.
And my name is Kayla Slaggers, and I am the Supportive Services Coordinator at St. Joseph's Hospice.
We'll take a look at our agenda today. We'll do a little bit of housekeeping, kind of how we always start off these webinars, and really diving into, as I said, Children's Grief 101. So very similar to last time, we'll be talking about those grief myths that we kind of encounter when we're talking about children's grief and youth grief. We might talk a little bit about how children's grief is different really from adult grief. One of the really important things to discuss when we're talking about children and youth is developmental stages. So we'll talk a little bit about that and how developmental stages influence children's grief experiences and expressions. We're going to talk briefly about complicated grief and trauma. This is not really an atypical or a typical experience of bereaved children and youth, but we do like to talk about it just in case you as a caregiver or a parent are concerned about maybe there being something a little bit more going on than just the children's grief experience. And so we do talk about kind of when grief gets more complicated, when professional help might be needed and that kind of thing. And then as always, we're going to end with our Teachable Moments slide, which is where we kind of talk about how you can take what we've talked about today and have a conversation with your child and kind of continue this theme outside of the webinar series. So this is a 5-part series. We're in week 2 of 5, and we'll be talking about a different theme or a different topic each webinar. I keep wanting to say each week, even though you could be watching these all, right back to back. But each time that we convene, we'll be talking about a different topic. So today, for example, it's children's grief. Next week, I think we're talking about continuing bonds and memories. And so each, like I said, each week will kind of start out the same with this housekeeping slide. We always try to end with teachable moments. The structure of the group, I mean, obviously this is a webinar series. So typically this group would be offered to parents and caregivers, or really any adult who is in a caregiving role of a bereaved child or youth. And typically we offer this group at the same time as our children's groups run at the hospice. But at least right now, I don't know when you're watching this video, we are in the middle of the COVID-19 pandemic. And so a lot of us are working from home. And we thought that it would be a good idea to record this material so that people can access it from home. And also we're not sure, when groups will be able to convene, that kind of thing. But also for busy parents and caregivers, not everybody can make it to an in-person group. And so if this is you and you're, not able to make it to the parents group, then this is for you. So that's about the structure of group. If you've received the link to this video via email, any resources that we talk about today, and probably a few extra resources will be emailed to you. However, if you're watching this on our YouTube channel and you're saying I don't have access to the slides or any of the resources, please send us an email. We would be happy to send the slides to you. We're happy to send different resources, as well as if you have any questions, comments, if you have any feedback, please email us, and the email for our supportive services email is right there.
Okay, thank you, Orly. So we are going to jump right in and talking about myths and common beliefs about children's grief. So the first one is that children should not be at the bedside of the dying. And often this also means that we shouldn't include children in these conversations about death and dying. But what we actually know to be true is all the things that we're going to talk about today, and how helpful it is to include children, to understand that they understand what death and dying is at different parts of their developmental stages. And so we want to tell you all about in this webinar series the importance of actually including them in those conversations. And that may mean also including them at the bedside of someone that may be dying, or even afterwards, and including them in that grieving process and including them in conversations. So the next one is, if the child isn't talking about it, then neither should we. So again, we want to role model talking about death and dying. We want to, talk about grief and normalize that. And we want to also take the lead and letting children know that grief is normal and grief is healthy, and we want to talk about it. So actually taking that lead and talking to children about these conversations is really important, to be opening up those conversations with people that they trust and people that they feel secure with. So it's better to say nothing than the wrong thing. We all make mistakes. The other thing that we know about death and dying is there's so much that we don't know about it. It's okay to explore these conversations together. And if you say the wrong thing or you're not really sure about an answer, that's okay too. What we know to be more important, again, is that we are including children in these conversations, and just knowing that we make mistakes and that you can always talk to your children about this too. It's better, again, that we have these conversations with children so that we can help decrease that magical thinking and explore the right information together. So as parents and even professionals, we have this need to protect children. So again, sometimes we sway away from, we don't want to have these conversations with our kids. Sometimes we want to hide some of that nitty-gritty details from them, and that's okay sometimes. But when we totally exclude them sometimes, there's a missed opportunity. Being at the bedside when someone is dying, or being a part of a funeral or a service, is such an important opportunity for children to learn about death and dying and life. It's a normal part of life, and it's inevitable. So the more that we can incorporate these into these experiences, the less isolated they might feel. There might be less fear, less worries, and again, can reduce that opportunity for them to come up with that magical thinking and things that may not be true. So there's actually a lot of research that actually shows about the importance of having these conversations with people that they trust, and having honest conversations, and including them in practices related to death and dying, and grief and rituals and that sort of thing. So preschoolers are too young to understand concepts related to death. Sometimes this extends to even, infants, toddlers, even school-age children. Sometimes people think that they're too young to understand what it means when someone dies, or to understand what they're experiencing. And we're going to talk some more about children's understanding at all different developmental stages, and what they understand to be true about death and dying. And again, we want to make sure that we're giving you guys that information and the tools to help children understand concepts of death and dying where they're at different stages. And the last one we have here is, the child will think about it all the time. So like us, we may think about death and dying, or like adults, we may think about our loved one that has died often, but we're also able to turn that off. And children have a really great ability to douse that pain and jump back and forth between the hard stuff and feeling those experiences and those feelings, and then jumping into playing again. So we're going to talk some more about that too. But like I said, even as adults, we think about death and dying often when we're impacted by someone that we love so much. And just like children, they have strong relationships and lots of love also. So it's expected that they are going to miss their loved one and experience grief, but they have the ability to turn that on and off, just like we do sometimes. Um, so children's grief, we're going to talk a little bit more generally right now, and then again we're going to talk some more and dive into some of these a bit more as we go on today. So children have immature cognitive development, which interferes with their ability to understand that death is irreversible, universal, and inevitable. So like I said, at different ages and stages of children's development, they have the ability to understand and grasp these concepts. And that's why it's so important for us today to talk about what those ages and stages are and at what levels children understand when death is no longer irreversible. And so children at the beginning, when they're in those younger stages, early school age, preschool, even toddlers sometimes, we can talk to kids about grasping the physical concept of death. And then as children progress and get older, they can then start to learn about the more abstract aspects of death and dying. So they do have the ability to understand some of these concepts, but it evolves over time. And so the more that we can support children at where they're at is the best that we can do in helping them understand death and dying. So children have a limited capacity to tolerate emotional pain. As I said, children have this innate ability to be able to be playing 1 minute, having fun with their friends, laughing, and then, all of a sudden they may be experiencing a grief burst, or they may be very upset or crying or talking about missing their loved one. And they have that ability, though, to then bounce back into having fun again and turning that off. So that's just part of children, and that's okay, and that's normal, and that's okay. So just to know that if your child is jumping in and out of that joy and sadness or anger and those emotional bursts, that's okay. And that's actually really healthy, because that's when we know that they are allowing themselves to feel some of those experiences of grief too. So I kind of touched on this one. They may have acute feelings of loss that occur in spurts over many years. So with children, they are grieving for a longer period of time and throughout their whole lives when they've lost someone that they love very young. So we may see these spurts of grief at milestones in their life, special holidays or birthdays, that this grief may really impact them the most. So if, maybe a 4-year-old has lost a family member or a parent, at their 5th birthday, at their mom's birthday in 3 years after the death, at when they graduate, or they can ride the bike for their first time. These might be those special moments, and into adolescence and adulthood, that we really noticed those feelings of loss and grief the most. And those are triggers that, just like adults, we have throughout our lives. So children have limited abilities to verbalize their feelings. So we may see more of their grief responses in their behaviors. And this is a way that they are helping to make sense of their world. They're feeling a little bit sometimes lost or out of control, and they don't know how to verbalize what they're actually feeling. And so they are expressing that through behaviors. Maybe that's they're receiving attention that way. They're not always able to recognize, maybe when it's grief that they're feeling, versus I'm mad at my brother or sister. So we may see regression or additional behaviors when a child is grieving. And so helping them to have that emotional literacy and helping with emotional regulation will really help children to recognize what they are feeling, and to just help them have that conversation about emotions and feelings. So children are sensitive about being different from their peers also. So children don't necessarily want to stand out all the time. They want to get along with their friends. They don't want to be the only child that doesn't have a mom, or they don't want to be singled out as the child that lost their brother at school all the time. So it's something to recognize that children, if they're not talking about it with their friends or in school or at soccer practice, maybe just because they want want to fit in, and they don't want to stand out as that only kid that's lost someone. Often kids, at school when they are young, they might be the only ones that have lost a significant person in their life or are talking about it. And that's okay. You may notice that children will be more open in asking questions or expressing, their grief or that someone has died at very random times. So it may be, you're at the grocery store and the child, you might be ringing in your groceries and your child goes, "Hey," to the cashier, "My dad died yesterday." And we know that as adults, that would just completely overwhelm us. We would have no idea why this person is sharing that with us. We just wouldn't hear it from adults. Whereas with children, they kind of pick and choose again and are able to just speak honestly about what is going through, what understanding they have of death and what's going through their minds at that time. But often we'll see it with adults and not their peers necessarily. And children are able to express their feelings in play. So play is a child's language. It's their way of making sense of the world. And this is ways that they can work through their understanding of concepts of death and dying. Maybe it's rehearsing what happened at a funeral, using figurines or their dolls or their Barbies or superheroes, and having, a doll or figurine, laying in a casket, or maybe it's burying them in the ground. And this is their way of processing what they've seen and working through what that means to them. So this is normal, and sometimes we refer to this as death play. And this is a healthy way of children expressing what they're understanding. So children's versus adults grief. So we're going to talk about some comparisons and how it differentiates and what we see in adults. So children, sometimes their grief may seem intermittent or absent, as we just talked about. They may be playing one day and not talk about it at all. And whereas adults, we have a more understanding of death. And so we are able to, in a more appropriate conversations or at times, try and talk about what we're experiencing or talking about our grief and the person that has died. Whereas children, they may not necessarily have that vocabulary quite yet, or they are not sure, when that appropriate time is to talk about it. So it might just come out of nowhere sometimes too. So, and that has to do with, again, their understanding of death and the dying. Children's grief is longer and they grow up with loss versus as adults. We may lose someone, say if as an adult, it's our parent, so it's the child's grandparent, they're grieving for the rest of their lives for such a longer period of time. Whereas adults, we already kind of have those coping skills and those abilities to then adjust to death and dying and have that understanding. We also have fuller memories and we're able to remember on our own, whereas kids, they may need help remembering those memories. They're taking on so much as a child, they're learning so much. They're not able to necessarily, they may have those memories, but they just may need help as they progress and get older, remembering those details. So it's such a great way to, engage in our grief and our mourning together as a family. And as your kids grow up, incorporating pictures and incorporating the person that has died throughout their lives. Children, like I said, may talk openly and honestly about death. Whereas again, adults, we have this understanding of cultural and societal expectations about death. And often we're more reluctant to share those experiences or less open to just talking about it with someone at the grocery store. And children are often more dependent on their caregivers and the adults in their life to meet their needs, whereas adults can meet their own needs. And this may be taking care of ourselves, expressing our grief and knowing what our coping strategies are, whereas children need a little bit more help in supporting them throughout their grief and these big feelings that they may be having.
So just to kind of sum up what we've been talking about, we have this great quote from Winston's Wish, which is a children and youth bereavement support program out of the United Kingdom. So for adults, grief is like wading through this enormous river, whereas for children, it's puddle jumping. But when they're in that puddle, it's no different to the river. So that idea that children, or even for adults, when we are experiencing grief, it is like we are in that deep, dark ocean and it's all consuming and we are in it all the time, kind of all in those maybe emotional experiences. Or, I mean, last webinar, we talked about how grief can impact us in so many different ways than just emotional. There's physical experiences, cognitive, it kind of impacts our whole being. But for children, they have this amazing ability to, and it's almost like it's their natural way of protecting their little psyches, is that they can jump into their grief and experience it really intensely as if they were in that big ocean like adults would be, and then they're on to doing the next thing. So a great way to remember that is that we might say children grieve in chunks, and that can be really challenging as adults because I have a lot of, so for example, parents who will call me saying, okay, I sat the child down and I explained to them that so-and-so had died, and I used the word died like you told me, and we talked about what died means, and my child cried for about 5 minutes and then said, can I go play outside? So then there's this feeling of, did I explain it wrong? Do they not get it? And it's totally normal. We would expect that, especially with younger children. So our job as professionals, as caregivers, as supportive adults, is to be with them and support them and bear witness to them when they're in that big, dark, in that big river or in that big, ocean. But also allow them to have space from it, right? So we don't want, it's really tempting to, when the child says, can I go play outside? You want to say like, wait a second, come back here. I want to keep talking about this, because we want to make sure that they understand. But it's really important when the child jumps out of that puddle, what they're telling us is that I've had enough and I need to go and maybe play, or I need to go and have some time away from these big emotions, and then I'll come back to them later. And so that's why, we use a lot of play at the hospice. That's why play is so important, because that's how children process their worlds, right? And so, but it can be difficult. And really, I mean, the other kind of nice thing to remember is that when a child is in that really intense experience, sometimes all we can do is just wait. We call it riding the wave out with the child. And if we can wait and just be with them in that moment, the chances are, if we give them a little bit of time, they will regulate themselves and do that, can we go play now? Or can I go play outside? Or, and so it can be really difficult to sit with that as adults, because again, we want to protect our children. We don't want them to feel pain, but really, if we can just be with those really big feelings, the child will kind of regulate that experience, and we're with them, and then they'll be on to doing the next thing. So we talked about the idea of puddle jumping, kids jumping in and out of their grief. The other concept that we like to talk about is stugs. So that's a sudden temporary upsurge of grief. And as you see, the picture that we've chosen to depict what a stug is the volcano kind of erupting, and there's this huge explosion. I think as adults, we can also identify with this idea of having a stug, being in a stug. Often it happens the most inopportune times, like when you're somewhere out in public, like at the grocery store. Sometimes it's triggered by something, like it could be a memory or some sort of sensory experience, like you hear your person's favorite song on the radio, or you smell something that triggers a memory of maybe that you had with your person. But sometimes they just happen out of nowhere and nothing triggers them, and that's totally normal. And then we have this reaction of this really big, overwhelming kind of eruption experience. And this is absolutely true also for children. So when we're in the puddle, it can kind of look like this, right? That they're in a stug kind of thing. And again, that idea of remembering that children grieve in chunks, it's very, very normal. I think for a lot of parents, it can be like a little bit concerning or maybe anxiety provoking that my child, it seems to be fine most of the time, and then all of a sudden we have these big explosions and I don't know where they came from. But just know that it's very, very normal, and it's just that child jumping in and out of those puddles and experiencing stugs. And even if we as adults experience stugs, very, very normal. Not enjoyable at all, but a very, very normal experience, a very normal part of grief. We would expect that.
I just wanted to jump in and say you may hear us intermittently using the words grief bursts as well. And when we're using the term grief bursts, we're referring to these stugs as well. So sometimes we use those words interchangeably.
We'd like to show you a video, and there's actually a series of them. So if you on your own time would like to check them out, they've been released by the Children and Youth Grief Network. And the person that we're about to hear speak is named Andrea Warnick, and she's Canada's leading expert in children's grief, children and youth grief and bereavement. And so she's going to talk a little bit about just what grief in children and youth can look like and how it's a little bit different than adults. I think what happens is that we as adults expect children to grieve like we do. And when that doesn't happen, we assume that the child is fine. And that doesn't necessarily mean that we think that they're not grieving. But the truth is that they do grieve. It's just, it looks very different from what our experiences are.
Recognizing children's grief can sometimes be challenging. They grieve in different ways than adults. Children often grieve in chunks. That's probably the best word to describe it. We all experience grief bursts, adults as well, but that's when we're going along, having a fine day, and all of a sudden something might happen to trigger our grief, and it feels huge. And so kids can often experience this in the school setting, especially around special anniversaries, such as Mother's Day, Father's Day, a birthday, and it's completely natural and healthy when that happens. And so what does it actually look like for children's grief to come to the surface? Because children lack the emotional vocabulary to often describe what they're feeling inside. So rather, it'll come out more as behaviors or actually feeling sick, maybe complaining of tummy aches, maybe complaining of headaches. It might be that the child's not sleeping properly. It might be that the child is mad more than sad. So there's more aggression. It might be that the child's not as confident as they were. A lot of kids too, the younger kids, will engage in death play, where they'll be playing and pretending that people are dying, which can be really concerning sometimes for teachers, but that's the safest place. Play is the safest place for kids to be able to explore the world and the things that they've experienced. A lot of times it'll be hard for kids of all ages to concentrate in a classroom when something hard's going on in their life. So it might be that even as a teenager, they're just not able to focus on the task at hand because they're too busy thinking about the fact that mom's at home dying right now. Some young kids will need to repetitively ask their questions over and over again. A lot of younger kids as well might need increased affection, and often teachers are where they'll go to receive that. And it's not uncommon to see changes in academic performances in both directions. So some kids and youth will focus so much on their schoolwork because they don't want to rock the boat, or sometimes because they don't even want to think about the fact that they're grieving in their life. And so they actually do better than they were before. But then for a lot of youth and children, because they're having difficulty sleeping or concentrating, they may actually realize that their marks are going down because it's really hard for them to focus the way they were able to before. These are all natural, normal, healthy aspects of children's grief. The question is, when do we get concerned? When do we know that kids actually need more support for their grief? So if we've got kids who have chronic tummy aches or headaches, any sort of physical symptoms without an organic cause, and this is going on for months, we really want to explore this and find out if there is anything else going on. I mean, maybe the child does actually have something happening with their stomach, but maybe they do actually need more support for their grief. If a child is persistently denying that this death has happened in their life, if they're having ongoing eating or sleeping disturbances, and of course, if there's any talk about self-harm, suicide, automatic support for those kids. And I'm also always watching out for kids who may be becoming more progressively isolated, or if we've got a child who used to love doing some activity, perhaps soccer, who now doesn't want to play soccer at all anymore, and months have passed since the death has happened. I want to get more support for that child too and make sure we're exploring what's going on for them.
Andrea really summed up this slide here. I think we saw a lot of what she talked about in the video, so we won't spend too much time here. I'll just kind of highlight one of the points that she brought up is that we often see children's grief come up in behaviors and in those physical feelings, like my tummy's sore, my head, I might have a headache, that kind of thing. And so behaviors are also really, really common. So that might be like that anger, aggressive behaviors, defiance, having trouble maybe following through with directions. And so that's absolutely children grieving. I think what we expect as adults is we expect them to have these really big emotions all the time. And that might happen, but we're not kind of attuned or really looking out for those big behaviors, but absolutely that's grief. That's what children's grief looks like. So she talked about a lot of these. I think one of the ones that she didn't talk about was some regression. So very, very normal. You might have a child who, has been sleeping in the big kid bed for a long time, but all of a sudden they're wanting to co-sleep with parents. Absolutely normal. Something to all of these, I don't want to say symptoms because that's pathologizing grief. All of these experiences or reactions to grief are very, very normal, but it doesn't mean that we want to not monitor them as parents, as professionals. They're all things to be keeping an eye on, and we're monitoring to see over time, are they, becoming worse, not better? Are they becoming more frequent? Are they becoming more intense? And that usually, if it's been a really long time, like months and months, and these aren't going away and maybe they're getting worse, that's usually a sign that more support is needed. Again, like we might see kids who, again, they've maybe been potty trained for a really long time and now they're having accidents. Again, really, really normal, just something to kind of keep an eye on. And then guilt can also be feeling like it's your fault that your person died. And we'll talk a little bit about why this often comes up in grief for children because of their development and because of magical thinking and having this idea that their thoughts, their inner world can have real world impacts on I said a bad thing and then so-and-so died, it must be my fault. So they're just things to be aware of. So then let's talk about, so Andrew didn't talk too much about youth, and it is very similar to children's grief. I think we also see a lot of somatic symptoms or those physical symptoms of headache, tummy aches, feeling really tired, exhausted, having trouble sleeping, that kind of thing. Maybe presenting as angry. It's a little bit, sometimes it can be easier to be mad than it is to be sad. Sad is definitely a more vulnerable emotion. With teens or with youth and teens, I think we also see this increased need to be with their peers, especially if this is a loss that many peers have experienced. So we think of the death of a student, perhaps. And that can be challenging for us as adults, either whether we're, family members or we're professionals, because I think we kind of want to have eyes on that teen or that youth, and we want to kind of be able to support them, but it's really normal for them to want to be with their peers. That's a very common developmental stage when you're a youth or a teen, being dysregulated, so having that hard time regulating emotions, like irritability, those behaviors, there might be that defiance, that kind of thing. Difficulty in school, like difficulty concentrating. I think I get a lot of referrals for teens, and it's usually the first thing that's kind of happening that is triggering that this teen might need more support is that their marks are usually going down. And then that causes so much more stress, right? Because now if I'm in high school and I'm maybe wanting to go to college or university and my marks are going down and I'm not sleeping, and then it's just this cycle of stress and anxiety. We saw loss of confidence, maybe fear or anxiety, changes in their academic performance. I think also for youth, there's this really challenging balance that they're trying to achieve, because one of the developmental tasks when you're a youth or a teen is that you're finding yourself, you're gaining independence, you're kind of coming to the stage in your life where you're kind of going out on your own, right? And you're separating yourself maybe from your family unit, and that's totally normal, like a totally appropriate developmental task that all youth and teens need to kind of achieve. And then something happens to you that makes you feel so dependent, and your world is turned upside down, and you are so the world isn't safe anymore. And so there's this push-pull, I think, with teens where they're trying to come to this place of finding independence and finding themselves, and then also struggling because maybe they're feeling more dependent on either caregivers or adults, or just feeling more vulnerable. So it can be really challenging. And I think the other thing that I would probably be concerned about or aware of with youth is one of the things that I'm watching out for as a professional is an increase in like risk-taking behavior. So, I mean, automatically that comes like, I think drugs and alcohol are usually the thing that comes to mind, but it's not always that, right? It could be dangerous driving. It might be shoplifting, like just that. I'm always kind of looking out for that increased risk-taking behavior, which can sometimes happen when youth are grieving.
Okay, so we want to just bring up what we talked about a little bit in the first week or in our first webinar about disenfranchised to grief. And Orly had mentioned, and I'm going to reiterate this, that often, in research and literature, we talk about children as the forgotten mourners. And this is because often their grief isn't recognized. As Orly had mentioned, sometimes we don't see or recognize children's grief because it seems different than the way that we're grieving, or maybe it's absent more so because they're going in and out of that play, and then grief bursts or behaviors, and we don't always recognize that as grief. So we assume that maybe they're fine, or maybe it's that sometimes lack of understanding of children's grief and us not recognizing at what age children experience grief. Sometimes we also think of children as the forgotten mourners because we want to protect them, as we talked about. So we're not always including them in these conversations, and they kind of get pushed aside or left in the other room or not included in those conversations. So we want to bring this up here because what we know to be so important with children's grief is that need to recognize what their grief may look like and what they may be experiencing, that it is grief, as Orly had mentioned in the last couple slides, and to validate what they're going through and validate their emotions and their feelings as grief and as it being a really hard experience. We don't want them to be those forgotten mourners. So we are going to talk about something called the 5 C's, and this helps us to understand what a child's interpretation of death may be. And so the 5 C's are kind of a quick and easy, catchy way for us to think about all these things that we want to be aware of when we're either supporting our children or recognizing what we're seeing in their grief. Okay, so did I cause it? So Orly had talked a little bit about that guilt. So children sometimes, because they can have, especially those younger children, can have some of these egocentric views and beliefs. They may think that something that they said or did had caused this person to die. So a child may think, oh, I told mommy that I really didn't like her that one day, or I told her to go away and then she died. Did I cause that? Was that my fault? A child might think. So really wanting to explain to children what that cause is and what has happened, so that they aren't magically thinking of these different ways that that person may have died or their loved one may have died. And often when children are thinking that they may have caused it, it's likely worse than that cause of death, right? And they can really sit with that guilt. So really unpacking those causes of death and what happened in an honest and truthful way is really helpful. Children may also think, can I catch it? So again, with that egocentric view, they may thinking, is this going to happen to me too? Am I just going to disappear one day? Or if we're not labeling how someone died or explaining that, they may think that it can happen to anyone, right? So if it's an illness or cancer, for example, we want to call it that. So that children are differentiating between an illness, between like a cough and a cold or an everyday feeling sick, versus something that may cause someone to die. We want them to know that they can't just catch something like cancer or catch being in an accident. And so just really clarifying and providing that reassurance about how and why that person died, and ensuring that they know that they're safe, they're not ill, and reminding them of that security and who's there to help them. So can I cure it? So children may think, is there anything that I could have done to help them? Again, clarifying that sometimes, bad things happen to good people. If someone, again, was ill, or if there's been an accident and the loved one was in the hospital, really wanting to explain that, even the doctors that are the experts and help people all the time, they did everything that they could. So-and-so's body just couldn't handle it, or their body shut down and they died. So, lots of people want to help, their loved one when someone is dying. But sometimes we can't fix that, right? And sometimes reiterating that also death is a natural and normal part of life can also help with this too. So death can't always be cured, and illness can't always be cured. And that's also that part of that natural life and death and living. So the fourth C is who will care for me. So this kind of relates to that, reassuring kids of their security and their safety, and letting them know who is going to be there to support them. Letting them know that you're going to be there for them, bearing witness, listening, supporting them when they're in that puddle, like Orly was saying. Who's going to be there for me? Well, I am. I'm going to be here with you, and I'm okay, and I'm safe, and I'm not sick, and reminding them of all those people and those positive role models in their life that are going to be there for them. This could include, of course, siblings, teachers, neighbors, aunts, uncles, letting them know about who is in their life and just that reassurance. We also want to remind them of or rehearse with them or let them know about things in their life that are predictable. So reassuring them of routine as well. So letting them know, I'm still going to be here when you wake up in the morning. You're still going to go to school and you're going to see your teachers, and, your grandparents are, we're still going to be able to go see them on the weekends and they're okay. So just reminding them of what they know to be true and of things that are normal in their lives to enhance that, that safety net around them, and that routine for them. And then the fifth C is a newer C that in research and that we've come to learn about children's understanding and interpretation of death. So, over the years, we learn more and more about grief and children's grief. And another really important piece, and this is related to a newer theory called continuing bonds that we're going to talk about next week or in our next module, is staying connected to our loved ones. So children want to, have that person in their life still remain a part of them. They don't want to forget this person that has died, just like we don't. So it's normal and healthy, and we want to encourage children to stay connected and still have that relationship with the person that has died, because if it's someone that's significant in their lives, they must have been really special. I'm sure they really loved them and they had a strong sense of attachment. So helping children to keep those memories alive, to incorporate that person into their life now, into this new normal of their physical body not being here, but them still being a part of their life, is so important. And children, like I said, they don't want to forget their loved ones. So helping them nurture that relationship and those memories is really helpful.
I just want to jump in and go back to, can I cure it? I think one of the other important things to remember just with that idea of like, can I cure it, is that magical thinking that children have. And so we have to kind of have that conversation. It doesn't matter how well you behave. It doesn't matter if you get really good marks in school or if you make the basketball team. Or I've had conversations with little ones about, I have a special unicorn necklace and I made a wish on the necklace that grandma wouldn't be sick anymore. And so we need to have kind of that, like, if I was really good, then we can't it doesn't matter how well we behave. We can't make a person's body not be dead anymore. We can't make a person's body not be sick anymore. Just because kids do often have that belief of that my inner world can have real world implications as well.
Mm-hmm. Mm-hmm. Thank you, Orly. Yes. So we are going to put up a handout here in a second that will go through all the developmental stages of children and how they understand grief at those stages and what we might also see. So we talk about this, and I know we've talked so much about, how children develop and their understanding of death grows. But what we also want to highlight is that before we touch on this handout is that children are unique, though. Every individual is unique, and we know that with anything in conversations about, your child's development, there's always a spectrum of, are they developing normally? Are they progressing the same as their peers or your other children? So just like grief, we know that children are going to develop, and they're going to develop their thoughts of death and dying and experiences of grief at their own stages. So they aren't going to perfectly fit in the same box as maybe another sibling or other children their ages. And so just knowing that they're going to also experience and explore grief at their own stage as well. And so for that reason, we know that children, their grief is going to be experienced differently throughout their life. And there is going to be those triggers and milestones that they reach that they may have, again, those increases of grief or those grief stugs or bursts. And so this is what we're referring to when we're talking about re-grieving, is that as children develop, their understanding and their concepts of death develop. And so they may have different realizations or beliefs about what is happening and what that actually means. So there's some of those abstract thoughts about when someone dies. And they may also express themselves differently, or again, do some of that role play or see some of those behaviors differently as their understanding evolves. Yeah, so as Orly said, you'll be given this handout, and it's such a great resource to be able to refer back to, as your children, or if you have multiple children at different ages and stages, or as they grow older and you're noticing different things, or you've experienced new losses, to kind of refer back to. This is a great handout that really outlines exactly at each stage what children's understanding of death is, common responses that you may see in those stages, and ways to help them. Because we're going to talk more in our future webinar series about ways to support children at different ages. But so I'm just going to go through and talk very briefly about a little bit about those concepts of death that children have in these stages. So in our toddler preschool age, children at this age don't fully understand that death is permanent, that the body or the person is not going to come back into their life. So like Orly was saying, they might still be wishing for their person to come back, or talk about how, they wrote a letter asking for mommy to come back. So they don't necessarily grasp that they're gone forever. And sometimes children also at this age, they don't always grasp that it's universal, and that we're all going to experience grief, and that it's impacting so many people, or death, it impacts everyone for that matter. So as children grow a little bit older and into that school age, they begin to have or explore their independence and trying tasks on their own, and they begin to be more concrete thinkers as they're mastering some more of those thoughts and concepts. So there tends to be more of that magical thinking, those fantasy thoughts, but they are beginning to more grasp those ideas that children, or that death it is permanent if they can understand the cause, and that they can't fix it or change that. And as our school age children grow into pre-teens and into that young adolescence, they're still mastering a lot of those thoughts, and they're becoming even more so concrete thinkers. And so they're starting to be able to understand more of those abstract ideas of death and grief. They're starting to make closer connections with friends and activities outside their home and their family. So starting to understand that, death and grief is permanent, that it's long-term, that they're going to live with this for the rest of their lives. and they're beginning to understand a little bit more of that permanency and that inevitableness, and that we're all going to die at one point. We're all born. Any living thing is born, and then it exits the world, and we all die. And again, this may come from them understanding death in other aspects of their life, recognizing that maybe friends have also lost someone that has died. And just recognizing that in other aspects of their life. And as children develop into teens or in the adolescent stage, they're able to think about more of those abstract concepts of life and death as we begin to as adults. They start to have those unique beliefs and understandings about themselves, their role in their family, their identity. And they're also, they're recognizing a lot of changes in their lives too. Maybe that's recognizing what their belief system is. They're learning more about sexuality. They're caring more about physical appearance and just developing into the person that they want to be. And they have a little bit more choice and freedom and independence in that sense, right? And that's impacted by peers and, again, family and support in their community. So again, they're able to, just express a little bit more about what their beliefs are about death and dying in life. And so supporting children or teens in this age, of course, and talking about those more adult conversations is so important. Again, not letting them become those forgotten mourners. So I'm not going to go too much more into this handout, but just know that it's a great resource. And if you have any questions at the end of this or anything that you recognize that's concerning, we're always here to chat that through with you. But again, just knowing that your child, again, at different ages may not specifically fit into each of these boxes, and that's okay too, because we know that grief is so unique for everyone. So, okay, so I am going to try and switch our view here back to our PowerPoint.
So we do like to spend a little bit of time talking, kind of, if you recall our video with Andrea Warnick, when is more support needed? I would advocate that any grieving child who has experienced the death of a loved one can benefit from support, benefit from, meeting other children or other youth who have had a similar experience. But when it's more either professional support, maybe counseling is indicated, what to be looking for. So we have this term called complicated grief. It's a very atypical response, and not like most people, most children and youth are able to metabolize their grief, they metabolize a loss and integrate it into their life just fine. Most children are very resilient in the face of death and grief. And especially when we're going through webinar series like this, where we're resourcing parents and caregivers to understand maybe what those grief myths are, and to put you in the best position possible to be able to support your child, the chances of developing complicated grief are very low. It's not a typical response. So I just want to preface the next few slides by saying that, but we do want to just talk about it because I think sometimes there are caregivers who are concerned, right? That maybe my child's response to this loss is not typical, and what should I be looking for, and what could I do as a parent, right? So we do want to talk about it, but I don't want to cause any anxiety or make people feel like, oh my goodness, I have complicated grief, my kid has complicated grief, because the chances are is that most children are able to metabolize and integrate that loss just fine into their life. So when we talk about complicated grief, it's this persistent and intense form of grief that doesn't really change or go away. So it might be characterized by, it's different for everybody, maladaptive thoughts, maybe dysfunctional behavior. We see this really continued yearning, longing, really intense sadness, or maybe being really preoccupied with certain aspects of the death, or certain thoughts or memories of the person who has died. So it's different than we talk about that puddle jumping or those normal waves of grief. It is almost, it's very intense, and then it doesn't change. And so in the DSM-5, which is a tool that clinicians will use in Canada to make diagnoses of mental illnesses like depression, anxiety, that kind of thing, there is a disorder called persistent complex bereavement disorder. Might also be called PCBD for short. And it's important to know that you cannot get a diagnosis of PCBD. For adults, it has to be actually longer than a year since the person has died. And for children, it needs to be more than 6 months, because complicated grief, or that really acute grief reaction, it can look very similar to early stages of grief. So if we think of, right after the person has died, there's going to be huge, intense sadness and longing and yearning and all of these things. But that doesn't necessarily mean we have complicated grief. It just means that we're in maybe that more acute grief stage in the first few months. And so if it's been, 6 months, 12 months, and we're still at that same intensity as we were when the person first died, that would be when we start to get a little bit concerned about complicated grief. So there's kind of varying opinions about what percentage of bereaved people can experience complicated grief or that persistent complex bereavement disorder. We think it's between 2 and 5%. Others suspect it may be 10 to 15%. We frequently see suicidal ideation being reported in complicated grief. Again, that doesn't mean that if your child reports, thinking about hurting themselves, or that your youth has struggled with suicidal thoughts in the past, that they automatically have complicated grief. And that is also often confused with PTSD or depressive disorder. So it's really important, if you are concerned that your child or youth maybe is experiencing complicated grief. Again, we need to make sure that we're thinking about that it's been quite a bit of time since the death passed, and we're not really seeing any change in intensity of those reactions or those responses to loss. But it's really great then to maybe make an appointment with your family doctor or a trained clinician who can actually diagnose or can really work with your child and support them, give them the best support that they need. So trauma, I think that we've all kind of heard this word being thrown around. We talk about traumatic losses, we talk about PTSD or post-traumatic stress. And obviously the death of a loved one is traumatic. So this is a great kind of definition of what maybe a traumatic loss could be. A death is considered traumatic if it occurs without warning, if it is untimely, if it involves violence, if there is damage to the loved one's body, if it was caused by a perpetrator with the intent to harm, if the survivor or the bereaved person regards the death as preventable, if the survivor believes that the loved one suffered, or if the survivor regards the death or manner of the death as unfair and unjust. So lots of deaths could fit into here and be considered traumatic deaths, but we don't want to assume that if a death is traumatic, does this automatically mean that my child has PTSD? And the answer is no. What we know about trauma is that it is very individual specific. It's not situational. So a child can experience a traumatic loss, but it doesn't automatically mean that they're going to have PTSD. It doesn't automatically mean that they're going to have complicated grief. It's very, very much based on the individual. Just thinking about going back to kind of that trauma, complicated grief, I've been, working at the hospice a long time, and I can probably count on one hand the number of children or youth that I've been concerned about for complicated grief, and most of the time they haven't even 6 months. And so, most of the time I think we end up kind of deciding to monitor, but that it's not there hasn't been enough time passed for us to make an accurate kind of appraisal or assessment of what the child is experiencing. And I've also worked with lots and lots of kids who were either present when the person died, who, maybe were in the car if there was a car accident, and they have not been presenting with those traumatic symptoms, so it's really dependent on the child. And for the most part, they're very resilient in the face of loss and death. And if we have, consistent, informed adults, either professionals or caregivers who understand about grief, like through this webinar series, then we're putting that child in the best possible position to move through their grief journey with as few long-standing negative impacts as possible. But if you have any questions about trauma or complicated grief, please absolutely email us. But let's talk about our teachable moments for this. I keep wanting to say this week, but our teachable moments for today. So ways that you can continue this grief work outside of group with your child. So right now, your child might be attending a group at hospice, and you're kind of watching these on the side, but maybe not, right? Maybe your child isn't attending a group and you're just watching these on your own time. So it might be, last time we talked about setting up a routine with your child of how you can have a conversation about either what you learned in this webinar series, or perhaps what they're doing in group and what you're doing in your group. So you can talk about what you learned this week. And a child-friendly definition, we'll talk more about this as time goes on, but the child-friendly definition that we use at the hospice for the word grief is it's all the feelings and the thoughts that you have when someone you love is dying or has died. So I would encourage you to have that conversation with your child. A lot of families, we don't have the language to talk about grief, right? And to kind of put it into child-friendly terms. And if we can have, as a family, a shared understanding of kind of what the definitions are, you can have really, really great conversations with your child about grief, right? So if I'm the child and I know that grief is all the feelings and thoughts that I have after someone I love has died, we can talk about, what do you think your grief feels like? So maybe it's, my grief feels really mad, or my grief feels really afraid. And so you can talk about, my grief feels like this. I wonder what your grief feels like. One of the things that I'll always say to kids is that, everybody on earth at some point is going to experience grief. It's really, really normal, but everybody's grief is different. So, mommy's grief might feel really sad, but your grief might feel really angry, and absolutely happy can be a part of grief too. And so it's just a great, if we can have that shared understanding and language around grief, then we can have some really rich discussions at home. So yeah, it might be checking in with your child, especially if we notice maybe our child is struggling. It might just be saying, you know what, how was your grief today? If they've come home from school and they're having a really bad day, it might kind of trigger them to think like, oh, you know what, my grief actually has been really big today, and no wonder I had a bad day at school. So it can kind of help us validate those experiences. And maybe it's having conversations about what kinds of things make your grief feel really big and what helps make it smaller. So it might be, sometimes I think for kids, unrelated things can make their grief feel really big. So if I have a fight with my sibling, then maybe it just makes my grief get bigger that day, or other, moments of distress. But what helps make it smaller? So it might be cuddling with a loved one, really, or playing with the dog, or going outside to play, or, writing in my journal. And so if we can have a conversation about what things help make grief smaller, then it's great for you to know as the caregiver, right? Because then we can kind of keep that in our brains for when a child is really experiencing their grief really intensely, for suggestions of coping strategies. But again, it's just making it really okay for us to talk about death and dying and talk about grief. So talk about kind of grief with your child. That would be sort of step one in our teachable moments. And then another great thing, and kind of an easy, not easy, but something that you're doing to incorporate these conversations of grief into your life would be, if you're watching a movie or something with your child, there are so many opportunities in media to have conversations with kids about death and dying and grief. So you might notice and discuss with your child themes about death, dying, and bereavement in children's books, movies, or shows, depending on what they're reading or what you're reading. So we talk about examples. I mean, like, you almost can't, we were trying to think of a Disney movie that doesn't have some sort of death in it. And it's really hard to find one. So most, Disney movies, there is the death of usually some sort of parent. And so, you could talk about, like, what do you think that character's grief feels like? Or, oh, it looks like that character's, parent died. Like, wow, I wonder what that must make them feel like. And it's just a way to, again, we're making it okay to talk about, and just showing that it's kind of pointing out those moments to children that grief, where grief is in a media. We were thinking about like book series. The Harry Potter book series has so many like grief moments and death and dying. Charlotte's Web is another popular children's book that talks about death and dying and grief. Most Disney movies, A Monster Calls is a great one about illness. Bridge to Terabithia, which is a book and a movie. We talked about, Finding Nemo, Coco, Frozen, The Land Before Time, Lion King. Like, so there's just really so many opportunities for us to have those conversations. And sometimes they can feel a little bit safer for children to have conversations about someone else than having to talk about my own grief. So maybe I can talk about how, what Simba's grief in The Lion King might feel like, whereas it would be different talking about my own. It's just a safe way.
Orly, I just wanted to mention another way that we can normalize and talk about death and dying in our everyday lives are, animals in life, or with seasons, right? So if we're or if we've noticed, an ant or an insect, or maybe it's an animal on the side of the road that has died, just again, normalizing how common death is in our lives for all living beings. And again, you could talk about, how do you think that animal's family feels, or I wonder what they're going through right now, and just kind of bringing that up in our everyday lives, because like you said, it's all around us in media and everywhere. So
absolutely, yeah. We will point out one more resource for you today. You can go to the next one. So this is Canadian Virtual Hospice is an excellent resource. If you Google them, they have a website. There's so many different articles and forums that you can, it's just a great resource if you're supporting a grieving child, or if you're grieving yourself. And once a month, they have a monthly a webinar series, and they call it Kids Grief Q&A. And so it's with Andrea Warnick, who's that person from the video we watched earlier. And so if you have a specific question about children's grief or about your child or youth, you can email them in ahead of time, and then she will answer them in the next month's webinar. So I mean, even if you don't have any questions, it's kind of great to log on if you can. I believe that you can sign up, and even if you're not able to attend, then they'll send you the recording. So you can see kind of what other questions parents are asking or caregivers, and being answered by, a leading expert in children's grief. And there are our references in case you're interested in seeing those. Thank you so much for joining us again. So this was webinar 2, talking about Children's Grief 101. And next time we'll be discussing continuing bonds, rituals, mourning, and how we can have those kind of conversations with our children. If you have any questions, please email us, but otherwise we will see you next time. So thank you very much for joining today.